Hi, my name is Lydia Maya, and this is my human anatomy practical exam, and I will be identifying the anatomical structures. I will be talking about the pectoral region, the circulatory system, the digestive system, and the respiratory system, and explaining the locations, functions, and the significance for embalming. The first structure I will be talking about is the pectoral region. This is the pectoral region. The pectoral major is the largest chest muscle covering the ribs. The function is adducts and flexation and rotates of the arm. The embalming relevance is surface landmarks, important for locating the axillary region vessels. The next structure is pectoral minor. It is deep to the pectoralis major. Function stabilizes scapula, assists in breathing. Embalming relevance is sits near the axillary artery vein for upper extremity fluid distribution. The next structure is the clavicle, and it is horizontal collarbone connecting the sternum to the scapula. The function is support shoulders and protects underlying vessels. Embalming relevance is used as a landmark for locating the subclavicle artery. The next structure is the axillary artery, and it's a major artery in the armpit region. Functions: supplies blood to the upper limbs. Embalming relevance is possible injection site, important for distributing fluid to the arm and hand. The next structure I will be identifying is the circulatory system, and the structure I chose is the common carotid artery, and it's located on both sides of the neck. Functions: it supplies blood to the head and the neck. Embalming relevance is most common primary injection site. So the next structure I will be addressing is the internal jugular vein, and it runs alongside the carotid. The function is drains blood from the brain to the face. Embalming relevance is common drainage sites paired with the carotid injection. The next structure is the femoral artery, located in the high thigh. Functions is major blood supply for lower limbs, and the embalming relevance is a secondary injection site, good for difficult cases, or like if you're embalming a female, instead of embalming her by the carotid, it is good to do it on the femoral artery. The next structure I will be talking about is the aorta. It's the largest artery in the body. Functions: carries oxygenated blood to the heart and the body, the entire body. The embalming relevance is understanding its branches, and it helps to predict fluid distribution. The next structure I will be talking about is the digestive system, and the structure I chose is the esophagus muscle. It's a muscular tube connecting the throat to the stomach. The functions is moves food through the parasitus. Embalming relevance is its location matters for aspiration and trocar placement. So yeah. The next structure is the stomach, and it's a muscular organ in the upper left abdomen. And and the functions breaks down food with acid and enzymes. The embalming relevance is aspirated during cavity treatment, landmarks for trocar guided. The next structure is small intestines, and it's a long coiled tube in the abdominal cavity, which is this right here. And the function is primary nutrition absorption. Embalming relevance is gas content and may cause distension, must be relieved during aspiration. The next structure is liver, and it is a large organ in the right upper abdomen, and the functions detoxifies blood, produces bile. And the embalming relevance is major landmarks during the trocar insertion and affects fluid distribution in the abdomen. The next structure I will be talking about is the respiratory system, and the structure is trachea. It's a windpipe extending from the larynx into the throat. And then the functions provides airway for breathing, and embalming relevance is landmark in neck dissections near carotid jugular structures. The next structure is lungs, and it's paired organs in the thoracic cavity. The functions is gas exchange. Embalming relevance is lung disease affects fluid distribution and may cause leakage or purging. The next structure is diaphragm. It's a dome-shaped muscle separating the thoracic and abdominal cavities, and the function is primary muscle for breathing. The embalming relevance is inferior border helps guide the trocar placement. The next structure is nasal cavity, and it's the upper airway behind the nose. The function is filters warm and moisten air. Embalming relevance is important in cases with purging, connects to sinus and complications. And that is my PowerPoint presentation for the Human Anatomy Practical Examination. Thank you.